This is a video for the correct use of personal protective equipment for a Scenario 2 clinical area, any area where aerosol generating procedures are in use. The PPE demonstrated in this video should also be worn for providers attending cardiopulmonary resuscitation anywhere in the trust. The list of aerosol generating procedures can be found on the staff COVID-19 portal linked on Connect 2. In this area, a base layer of PPE consisting of scrubs, a waterproof gown, an FFP3 mask, eye protection, hair protection and surgical gloves have to be worn at all times. Additionally, a top layer consisting of apron and a second pair of gloves must be worn over the top of the base layer for patient contact. The apron and gloves will be changed after each patient contact by doffing inside the isolation room or bay and donning outside of isolation side rooms or between patients in isolation bays. Before entering the ward, hand hygiene is essential with alcohol gel or soap and water. All equipment must be put on inside a designated donning area. On exiting the ward, all equipment must be taken off inside a designated doffing area. When leaving a ward, you will need to have changed out of scrubs and into your usual clothes. Potentially contaminated scrubs must not be worn outside of Scenario 2 areas. Donning instructions. Please complete the following in the designated donning area. Change into scrubs before entering the designated donning area. Scrubs have to be put on in changing rooms. Hand hygiene is essential with alcohol gel or soap and water. Don a waterproof gown, tying it at the back. A buddy is helpful when putting on a waterproof gown. Put on an FFP3 mask. If you wear glasses, these should be removed before donning the FFP3 mask. Clean them with an alcohol wipe and put back on before moving to the next step. Position the upper straps of the FFP3 mask on the crown of your head above the ears and the lower strap at the nape of the neck below the ears. Ensure the FFP3 mask is flat against your cheeks and under your chin. With both hands, mould the nose piece from the bridge of your nose by firmly pressing down on each side of your nose with your fingers until you have a good facial fit. You should then fit check the mask. There are videos of correct fit checking practice on the CUH COVID staff portal website. If you cannot achieve a fit check, you should not enter the Scenario 2 area. Put on a disposable face shield to protect your eyes. Goggles may also be used if the face shield is unavailable. Put on hair protection such as a theatre cap. Put on surgical gloves, ensuring a good seal with the gown sleeves. Put on a plastic apron. Snapping the neck loop allows for the neck to be covered. Put on standard gloves. Please take time to check all PPE is done correctly and ideally get a buddy to check this with you. Working on the ward. Computer equipment in the Scenario 2 area is considered contaminated and should not leave the area. The computer equipment should be used wearing the PPE with the apron and gloves over the base layer of PPE. When seeing a patient, where possible, ensure a safe distance is kept from their face at all times. The end of the bed is a good measure of the appropriate distance. Ensure you have any equipment you require to hand or located in the bay and that a regular cleaning schedule is in force. Treat any equipment as contaminated unless you personally have witnessed it being cleaned appropriately. Do not spend more time than is necessary in the high risk zone, equivalent to 1 metre of the patient's face. Following patient contact. Once patient examination or care is complete, and while still inside the patient's space or room, remove the top pair of gloves and use alcohol gel to decontaminate your gloved hands. To remove the gloves correctly, grasp the outside of the glove with the opposite hand and peel off. Hold the removed glove in the remaining outer gloved hand. Slide the fingers of the first hand under the remaining outer glove at the wrist and discard as clinical waste. Alcohol gel the inner gloved hands, taking care to use the correct technique. Remove the apron and alcohol gel the gloved hands. Move outside the isolation area and perform hand hygiene. Don a new apron. To avoid cross-contamination from mask and goggles, break the neck strap and retie it. If you are working in a multi-bed bay, apron and gloves can be changed between patients in the bay. This may also apply to an area such as ED resus. Put on a new pair of gloves. Repeat these steps after each patient encounter within the bay. When all the patients have been seen, please ensure you don a new set of apron and gloves on leaving the patient's bed space or room. Apron and gloves are to be worn on top of base layer PPE at all times whilst inside a Scenario 2 clinical area. This means 2 pairs of gloves are worn when using computers, workstations and instruments. Leaving a Scenario 2 clinical area. Please complete the following at the designated doffing area. Identify the correct bin to dispose of PPE into. This should be an orange bin bag only. Ideally, a buddy should be supervising your doffing. Once you are ready to leave a Scenario 2 clinical area, go to the designated doffing area. Remove the top gloves and alcohol gel your gloved hands. Remove the apron. Alcohol gel your gloved hands. Remove the inner gloves and alcohol gel your hands. Remove the waterproof gown by untying the side tie and then grasping the inside of the gown near the neck. Pull it away using a peeling motion. Avoid touching the outside of the gown as it will be contaminated. Perform hand hygiene. Remove the hair protection by pulling backwards and discard. Then perform hand hygiene. Remove the disposable face visor or other eye protection. If you have a face shield, use both hands to handle the elastic straps by pulling outwards and then upwards over your head. Ensure you keep your eyes closed during this motion and place the face shield in the dustbin. Use alcohol gel to decontaminate your hands. Exit the containment ward area and then remove the FFP3 mask by leaning forward and without touching the front of the mask, pull apart the lower strap and lift it over your head. Then lift the upper strap and gently let the mask fall away from your face and drop it into the waste bin. Then perform thorough hand hygiene for a final time. Go to the staff changing facility and change out of your scrubs into your normal clothes. Alcohol gel your hands on the way out of the ward. There are 3 other circumstances outside of Scenario 2 clinical areas where this Scenario 2 PPE should also be worn. These circumstances are any patient requiring cardiopulmonary resuscitation anywhere within the trust, any time that an aerosol generating procedure is being performed, the list of which can be found at the link shown, any patient having intubation or assessment for major trauma in the emergency department.